Okay. Thank you very much for being here today. We get started. My name is Tiago Godoy, and I'm part of the communications team here for the Mediaula Group. And I'm here to talk to you about the mentoring and hands-on training 2026. So the Canabrava Cataracts 2026 program. So without any further ado, let's get started with this. So what we have here is the Observer Fellowship and mentoring and the hands-on training. Okay, so you guys are going to be able to know everything about it. If you have any questions that I can answer, you can put it on the chat and see, and or later on our team will be getting in touch with you guys. So what we have here in the cataract surgery program, the Observers Fellowship and the mentoring program, you'll find what's changed from the last year. So we're going to introduce you the mentoring, this new perspective for professional development cataract surgery, and more intensive program in less time, actually in 20 weeks, which is great for you. So on a weekly basis, Dr. Sergio will discuss the areas in which the program participants wish to improve. All right. So every week you'll be able to talk to Dr. Canabrava and then talk about whatever you need to get improved in your field, right? So, and two mentees must submit a surgical video with intraocular and external images, so Dr. Canabrava can check out to see how you guys are doing. So those topics will be subject for discussion with the all fellows, right? And best practices towards overall development. So we're going to talk about whatever you did wrong, whatever you did right, what were in the areas that you guys can improve in this mentoring program. This is a very fun program. So before we start the program, each fellow, okay, our mentees, right, must complete a form explaining which field they wish to develop with Dr. Canabrava as follows. So the basic surgical techniques or complex cases indications for premium IOLs. Okay, so important. The chosen field must be directly related to the surgeon's professional routine. Okay, so this is something that you guys need to improve, not to learn about. So and something that you guys can use for the rest of your career further on. All right, so moving on. So this live mentoring program. So what's going to happen on a weekly basis? So you're going to have you guys going to talk about premium lenses and recommendations. Okay, updates of the year, what happened during that year, so you guys can be up to date to everything that's going on. All right, so the oral presentation training and the Q&A, and of course the first thing that I kind of script that part, analysis of the surgical videos of mentees. All right, so online every Wednesday at 10:30 Brazil time. So every Wednesday at Brazil time, at 10:30 Brazil time, you guys are going to talk about all those topics. All right, and you're all gonna have the Q&As with Dr. Canabrava. So still moving on about the Observer Fellowship or the mentoring program schedule. So from weeks 1 to 5, the Advanced Cataract course, in addition to the Advanced Cataract course content, we'll have two fellow or mentees presenting a summary of the week's lectures, okay? And plus two other fellowship or mentees having their video discussed live with a maximum of 10 minutes of per presentation. So you guys are going to be able to, like I said before, to see what you guys can improve during your surgery practices and talk about it. So have this very healthy and good discussion about your practices during the course. All right. So on a week 1, which starts on February 3rd, you guys are going to talk about phacoemulsification principles and applied anatomy in cataract surgery. Okay, so the parameters, instruments, positions, applied anatomy, Rex's management, and more, and advanced IOL calculations, the formulas, calculators, and more. So on week 2, on February 10th, premium IOLs, so the toric, EDOFs, and trifocals, and the best IOL for your patient, right? So aberrometry, patient symptoms, and more. On week 3, February 17th, you guys are going to talk about the posterior capsular rupture management, anterior and posterior vitrectomy, trocar sclerotunnel, cornea incisions and other situations, and sclerofixations, maintainer vitrectomy, sutures and IOLs, mastering glued IOL, the Canabrava four flange technique, which is a very cool technique. So on week 4, on February 24th, small pupil, so rings in the market, surgical techniques, indications, challenging in small pupils and other cases, and subluxated lenses. So subluxation score, CTRs, CTS, steps for subluxated management, and more. And on week 5, on March 3rd, challenging cases. So aqueous misdirection, hyperia, hyperopia, sorry, myopia, LID, retropulsion. My God, it's kind of getting on the way. White cataract and more, and pupilloplasty. All right. So those are all the topics that you guys are going to see in the advanced cataract course schedule, week 1 through week 5. So it starts on February 3rd and goes all the way to March 3rd, the last week actually. So from weeks 6 to 20, the mentoring program. So on a weekly basis, we have 2 mentees presenting videos and receiving mentorship from Dr. Sergio Canabrava. And like we said before, 2 fellows bringing 2 cases for discussions. Moving on. So what's we're not going to talk about the hands-on training, right? So creating a skill in surgery to transform your life. Why we say that? Because it's actually a hands-on training itself. So you guys are going to get to come up to Belo Horizonte, which is the city where Dr. Canabrava lives. So and then be like in a full intensive program, hands-on practice with doctors, mentoring you, beside you full time. You're not gonna be just released in the wilderness, of the country to see what happens. No, you guys are gonna be mentored full time. So we're gonna talk a little bit here about the city, the NEO, so the training center where you guys are gonna perform, the program itself, and again around the city. All right. So Belo Horizonte is a city in Brazil. Okay, home of the Homeopathic Surgery Center, where you guys going to perform. So it's got in the metropolitan area around 5 million people, one of the best quality of living in the country. Planned city, founded in 1897, so it's quite new. Vibrant culture, home of many immigrants, a lot of bars, a lot of entertainment for you guys to see. Very well connected hub, so you can get to Sao Paulo, to Rio, directed flights to Europe, North America, and all main cities like Buenos Aires in Argentina, for instance, in South America, and around the country. It's a nice place. I've been to Belo Horizonte a lot of times, and it's a very good place. So here are some pictures of the city that you can find. It's a very beautiful city. I think you guys are going to enjoy it, especially for the week that you guys are going to be training. So talking about the NEO Center of Excellence in Ophthalmology, let's move on. So here we have the facility. All right, so it's this building with a lot of equipment for you guys to use. So the phacoemulsification system is is the Centurion, and the microscope uses Leica and Zeiss lenses. Okay. So let's take a closer look. I'm gonna show you this little video of Neo. Okay. Oops, that's so this is the facility. Okay, so you're going to perform in this medical center, which is very well equipped. And like I said before, you are going to be around, very experienced doctors, and Dr. Canabrava will be there as well to mentor you in every surgery that you guys perform in the center. Okay, so it's a nice place to be. Let's take a closer look. Nice. So coming back to this closer look. So if you guys have any questions, you can ask around here in the chat, or our team will get in touch with you guys to answer any further question that you guys might have. All right. So moving on, let's meet the people that are behind the program. Okay. So you have, like we said before, Dr. Canabrava, all right? So it's a multiple Congress award winner, published papers on the world's main cataract publications, such as JCRS or Cornell Journal. The best papers on the main congresses, innovative devices developed, techniques developed, and peer review and editorial board members. So he'll be there, mentoring you guys. So Dr. Rodrigo Versiani, so he's a cataract and retina surgeon. He's a member of the Brazilian and International Societies, all right? Chief director of the NEO Center of Excellence in Ophthalmology, and director of the Retina Institute, so the Fellowship in Clinical and Surgical Retina. And Dr. Wendell Martins, so he's a cataract surgeon with a track record of over 50,000 surgeries done. So he's creator of the FACOS elementary cataract teaching method based on high volume and surgical fractions, and over 50 surgeons trained himself. Okay, so those are the three doctors that will be behind you all time, mentoring you guys, checking you out and being there while you guys are doing the surgeries that you need to do, right? So let's see the value that you get for that. So the Ophthalmic Center, the OSC training is 100% hands-on. Okay, it's one-on-one system, so student and a tutor during all the procedures with the patients directly in the operating room. Okay, so what does it mean? It means, like I said before, when you guys are there operating with the patients, the mentor, the tutor will be there with you. He's going to be like holding your hand and saying, and checking you out to see what you guys can do, what you guys can improve, right? So that's the thing. You're going to be, doing surgery around surgery, and then he's going to be there, teaching guys, following all the way. Okay. Okay, Mona, you asked when the one-on-one training is going to be, right? So this training, our team will get in touch with you to tell you when it's going to be performed, what is going to happen. So like I said, so the training strategy is customized to the student's goals, and it's based on a high volume, right? So fractionalized surgical method with an average up to 10 surgeries per 4 hours of training. So depending on you guys and what you guys have to improve and how much you have to improve, it takes maybe 10 surgeries in 4 hours, right? You can do every day. So in a weekly intensive training module, it's going to take between 30 and 40 surgeries during the 5 days of this period. All right. So you're going to have to distribute this period in five systems. So up to 10 surgeries per period, intensive focusing, like I said, 10 surgeries in 4 hours, up to 4 surgeries per period with a slower pace. So you can, if you think you have more to learn. And the final program can be customized based on the student's skills, tutoring methodology, and your objectives itself, right? So the amount you guys have for it is 11,000 weekly intensive module. So during that week in the hands-on program, it's 11,000 for the hands-on the program, and the conditions and requirements to the medical practice in Brazil apply. So you guys have to have some sort of license, a bureaucratic system here, but we will inform you how it works. So our team, like we said, Mona, will get in touch with you guys so you can clarify all those questions and all the bureaucracy you guys need to being able to practice here in the country, right? So full support and travel prior to training start. So everything that you need, hotels, it's not included in the 11,000, but we can, you have the support of our team. So the flight selections, hotel options around the facility, and the transferring from the airport within the locations. Okay, but like I said, so travel costs does not include in the training fee. So it's the 11,000 for the training fee, and the travel costs, of course, it depends on the country that you guys coming from. All right. So moving on. So the pre-selected applicants will be contacted within the next few days, to schedule an interview. All right, to check what you guys, to like we said, to make this hands-on program more suitable for you. right? And you have to confirm the payment of the selection process, this interview fee, which is $190 to be deducted, okay, from the program's fee once enrollment is confirmed, or refunded if enrollment is not confirmed. So we just need this advance $190. All right. And if you do not confirm the training program, the hands on program, it will be returned to you. It's just for our interview fee process here. Okay. And of course, if you guys actually pass the program and you're part of the selection process, this kind of things, and you are part of the hands-on program, the $190 will be deducted from the final pricing. So that's the presentation that I had prepared here for you guys. Okay, I hope you guys enjoyed. And like I said, Mona, you talk to our team, and then we're gonna suit the best way for you to get here to the country, and suit to you the best months where you can come. This is a discussion. It's a one-on-one discussion. Okay, so I hope you guys enjoyed it. I've been, I'm glad to be here with you guys today, and I hope you be part of our program. Thank you very much. See you next time. Bye bye.